So how will this mRNA vaccine rollback impact future health research and healthcare in the United States? For that, we turn to Will Humble for some answers. He is the executive director of the Arizona Public Health Association. Will, good to have you on the program.
Good evening, thanks.
Okay, so how significant, put it in perspective for us, is this decision to stop funding for mRNA vaccine development?
I think the biggest implication is with the development of developing influenza vaccines. And so in the United States, as it is in the rest of the world, you have to decide months and months ahead of time before the influenza season what you're going to put in that vaccine, because you have to grow the vaccine in fertilized eggs. It takes months. What mRNA technology provides is an opportunity to develop those influenza vaccines much later, so that you can look at the surveillance, for example, from the Southern Hemisphere and develop your influenza vaccine for the fall season within a couple of months. So you have a much better opportunity of really developing a good, safe, and effective vaccine much more quickly. And where that has the biggest implications, well, it does every seasonal flu season, it would have implications, but enormous implications during influenza pandemic like we had with H1N1.
Yeah, it sounds like they're simply off and running and ahead of the game if they're doing that. But let's talk a bit about what's at stake about these messenger RNA innovations. If federal government funding is pulled back, as I understand it, medical organizations and individual states are apparently trying to come up with their own plans to deal with this latest federal decision. Is that something that could even work?
Partially, perhaps, but nothing like it is now. So the way it works in the U.S. is these pharmaceutical companies put research and development together to figure out how to make new therapies, new drugs, and new vaccines. But they're unwilling to put that basic research in place like the National Institutes of Health and the federal government pays for, that does the basic research to figure out how you can use mRNA technology, for example, to develop an influenza vaccine. Once the federal government funds the kind of research that makes it profitable, then the private companies can come in, use that research, put in some additional research and development, and then bring that vaccine to market. But they're unwilling to put that basic research money in play because there's not a big return on investment right away. And that's why it's so critical to have federal government funding for that base of the pyramid type of research that makes all of these therapies and vaccines possible.
Break it down for us. Explain in layman's terms what Kennedy Jr. is arguing for and the arguments why this isn't necessarily a very good thing at all.
Well, you heard in the intro what his argument was. He didn't base it on any kind of evidence. And somebody in the intro did a really nice job explaining Mr. Kennedy, who has always been an anti-vaccine person, and that's fine, if you're a lawyer suing people, which is what he's been doing for decades. But now he's got the power of the state, and he's using that power of the state to cancel messenger RNA research for vaccines because he's just essentially doesn't believe in them, despite all the evidence of how promising this is. So I don't know how we're going to get out of this. I do believe that the European democracies and China they're not going to stop doing this kind of research. And so at the end, what this is going to do is leave the United States further and further behind in messenger RNA research, which is extremely promising, not just for vaccines, but also for cancer treatment like pancreatic cancer, skin cancers like melanoma. This is a very promising technology that we are essentially abandoning in the United States.
Okay, so let's also talk about this decision and how it could adversely affect global vaccine equity, especially among lower income countries that right now rely on U.S. funded research and its distribution.
Well, not unlike the United States abandoning the U.S. Agency for International Development, USAID. This is, and all the other things that the State Department is canceling. This is just another decision by the United States government that we're going to continue to see for the next 3 years, I think, that just doesn't care about equity. I mean, if you want to know the truth, this United States government does not care about what the question you just asked. They don't care. what happens in developing nations. And quite the decisions they're making suggest they don't care what happens here either.
Yeah, I just saw a poll yesterday that said that Kennedy is the most popular in the United States among members of Trump's cabinet. So I'll let that kind of marinate, if you will. So on a side note, if he goes out and talks about this, what is it going to do to parents who are considering having or reconsidering having their young children vaccinated before they go on to public schools? What could this do down the road?
Yeah, so now we're emerging into not just what he's done by cutting all this research in messenger RNA vaccine research, but he has been talking down vaccines his whole career. And he continues to do that despite this little soundbite that he gave during his prepared statement that you just played. He continues to use the power that he has as Secretary of Health and Human Services to discourage vaccination. And the people that believe in him, and as you mentioned, he is popular with a segment of the country, not popular with me, but there are people who believe that he's on target with stuff, and they listen to him. And when they listen to him, they decide not to vaccinate their kids. And that results in the kinds of outbreaks that we're seeing right now in Texas, where there's more than 1,300 kids have been infected with measles unnecessarily because their parents have chosen not to vaccinate their children. And that's going to continue to get worse for as long as Mr. Kennedy has the bully pulpit as Secretary of Health.